Diabetes is a chronic disease that occurs when your body struggles to regulate blood sugar levels properly. It can lead to many health issues over time if left untreated or poorly managed. The condition happens when there is either not enough insulin produced by the pancreas or the body becomes resistant to insulin, according to the World Health Organization, WHO. Diabetes is among the leading causes of death globally, accounting for an estimated 1.5 million deaths in 2019. Approximately 53.2 million people in the United States alone are living with diabetes. That's more than 1 in 10 Americans. What is even more alarming is that this number is expected to rise to 64.3 million by 2030 and 79.4 million by 2045. The scary thing about diabetes is that it may not show any signs or symptoms, but it's silently damaging your organs. That's why it's crucial to learn about the warning signs and risk factors so you can take preventive measures and seek treatment when necessary. So let's get started. What is diabetes? Diabetes is a metabolic disorder characterized by high blood sugar levels due to problems with insulin, which is a hormone that regulates glucose metabolism. There are different types of diabetes, but the most common ones are type 1, type 2, and gestational diabetes. Type 1 diabetes is an autoimmune condition where the body attacks its own insulin-producing cells in the pancreas, leading to an absolute insulin deficiency. Type 2 diabetes, on the other hand, is characterized by insulin resistance, meaning the body doesn't use insulin properly, which can lead to high blood sugar levels. Gestational diabetes develops during pregnancy and affects women who are not diabetic, but develop high blood sugar levels during their pregnancy. Causes of diabetes: type 1 diabetes. This form of diabetes usually develops in children and young adults, although it can occur at any age. The exact cause is unknown, but it is believed to be an autoimmune condition triggered by a viral infection in genetically predisposed individuals. This means that type 1 diabetes is not preventable, but managing the condition effectively can lead to a long and healthy life. Type 2 diabetes. This is the most common form of diabetes, and it can develop in anyone. However, certain risk factors can increase your likelihood of developing type 2 diabetes, including being overweight or obese, having a family history of diabetes, physical inactivity, unhealthy diet, particularly high in processed foods and sugary drinks, and age. As you grow older, your risk of developing type 2 diabetes increases. But it is important to note that type 2 diabetes can often be prevented or delayed with lifestyle modifications such as weight loss, regular exercise, and a balanced diet. Gestational diabetes. This type of diabetes occurs during pregnancy and can affect women who are not diabetic. It typically develops when the body cannot produce enough insulin to meet the increased demands of pregnancy. Several factors can increase the risk of developing gestational diabetes, including being overweight or obese, having a family history of diabetes, and ethnicity. Certain ethnic groups, such as African Americans, Hispanic Americans, American Indians, and Asian Americans, have a higher risk of developing gestational diabetes. Signs and symptoms: type 1 diabetes. Some people experience an abrupt onset of symptoms, while others may notice a gradual progression. Common signs and symptoms include frequent urination, excessive thirst, unexplained weight loss, increased hunger, fatigue, blurred vision, and slow-healing sores or cuts. Type 2 diabetes. In the early stages, type 2 diabetes may not cause any noticeable symptoms or may be mistaken for other conditions. As blood sugar levels continue to rise, symptoms may include frequent urination, increased thirst, blurred vision, fatigue, skin changes, such as dryness or itching, and recurrent infections. Gestational diabetes. Many women with gestational diabetes do not experience any symptoms. However, some may notice increased thirst or frequent urination. Regular prenatal care, including blood sugar monitoring, is essential to detect gestational diabetes. Now that you know what diabetes is, its causes, and some of its signs and symptoms, it's essential to understand the complications that can arise from this condition. High blood sugar levels associated with diabetes can damage various organs and systems in the body over time. These complications can significantly impact a person's quality of life and overall health if not properly managed. Let's explore some of the most common and serious complications of diabetes. heart disease, and stroke. People with diabetes have an increased risk of developing cardiovascular diseases, including coronary artery disease, heart failure, and stroke. High blood sugar levels can damage blood vessels, making them more prone to narrowing or blockage, which restricts blood flow to the heart and brain. This can lead to heart attacks, strokes, and other cardiovascular events. Nerve damage, also known as diabetic neuropathy. Prolonged high blood sugar levels can harm nerves throughout the body, including those responsible for sensation, movement, and organ function. This can result in numbness, tingling, pain, weakness, and loss of balance. Diabetic neuropathy can affect various parts of the body, such as the feet, hands, and lower legs. Kidney disease. Kidneys play a vital role in filtering waste and excess fluids from the bloodstream. However, high blood sugar levels associated with diabetes can put a strain on the kidneys, leading to a condition called diabetic nephropathy. Over time, this can result in kidney failure and the need for dialysis or kidney transplantation. Eye disorders. Diabetes can cause various eye problems, including diabetic retinopathy and cataracts. High blood sugar levels can damage the blood vessels in the retina, leading to blurred vision, floaters, and in severe cases, blindness. Cataracts, which are cloudy areas in the lens of the eye, can also develop more rapidly in people with diabetes. Foot problems. Poor blood circulation and nerve damage in the feet can make it difficult for diabetics to heal from injuries or infections. This can lead to ulcers, wounds that refuse to heal, and in severe cases, gangrene. Regular foot care and attention to any cuts or sores are essential to prevent complications. Here are some things you can do to prevent diabetes. Maintain a healthy weight. If you are overweight or obese, losing even a small amount of weight can significantly reduce your risk of developing type 2 diabetes. A healthy diet and regular exercise are essential for weight management. Eat a balanced diet, focused on consuming whole unprocessed foods, including plenty of fruits, vegetables, whole grains, and lean protein sources. Limit your intake of saturated and trans fats, as well as added sugars and processed carbohydrates. These types of foods can contribute to weight gain and insulin resistance, increasing your risk of type 2 diabetes. Stay active. Regular physical activity can help improve insulin sensitivity and lower your risk of developing type 2 diabetes. Aim for at least 150 minutes of moderate intensity. Aerobic exercise, or 75 minutes of vigorous intensity, aerobic exercise per week, along with muscle strengthening exercises targeting all major muscle groups 2 or more days a week. Get enough sleep. Sleep deprivation can disrupt hormonal levels that regulate blood sugar, potentially increasing your risk of developing diabetes. Aim for 7 to 9 hours of quality sleep each night to support overall health and metabolic function. Manage stress effectively. Chronic stress can elevate cortisol levels, which may lead to insulin resistance and weight gain. Find healthy ways to manage stress, such as through exercise, yoga, meditation, or spending time in nature. If you're concerned about your risk of diabetes or have any of the risk factors we discussed, it's essential to consult with your doctor. They can help you assess your individual risk, recommend preventive measures, and provide guidance on lifestyle modifications or early intervention strategies. Don't wait until symptoms appear. Take proactive steps today to protect your health and well-being. Remember, knowledge is power, and by understanding the risks and taking preventive measures, you can significantly reduce your chances of developing diabetes and its potentially serious complications. Stay informed, stay proactive, and prioritize your health. You only get one, so take good care of it. Thank you for watching this video. If you found it informative and helpful, please don't hesitate to give it a thumbs up and share it with anyone who might benefit from this information. We would love to hear your thoughts and comments, so feel free to leave them below. And if you haven't already, please subscribe to our channel and turn on notifications to stay updated with our latest videos. We've got plenty more insightful content coming your way. Thanks again for watching. We appreciate your support and hope you continue to tune in for more health and wellness tips. Take care and see you in the next video. We understand that dealing with diabetes can be challenging, which is why we included a link in the description of this video to a product that might make your life a bit easier. This product could be a valuable tool for those looking to manage their diabetes more effectively. So be sure to check out the link in the description for more information and see if this product is right for you.